Okay, well, welcome everybody. My name's Kevin Ring. I'm president of FAM. Really excited to talk about all things Florida again. We have a very special guest, and I'm going to introduce our other guests to talk about Florida's response to the COVID crisis. But first, many of you who have been following us saw the news last night about the tragic death of Andrea Baer, who was a 30-year-old woman who was hooked to a ventilator, gave birth to a child, and then passed away shortly thereafter. And I want to mention that because today FAM's calling for an investigation into that matter. We know that some prison deaths are going to be unavoidable during this pandemic, but this does not seem to be one of them. And when we talk about keeping them safe or sending them home, this is precisely the type of case we're talking about. This woman was arrested and charged with a nonviolent drug crime. She was only given a 2-year sentence. And the fact that even with her pre-existing conditions and being pregnant, that she was transferred from a jail instead of to home confinement or to a hospital, that she was sent to a federal prison to contract this disease and then pass away is a national disgrace. It is immoral. It should bother everybody. As I said, we know we're not going to prevent every death in prison, just as we can't prevent every death on the outside. But I think her case is tragic, and it shows the stakes that that people inside, especially those who were not given life sentences, we are exposing them to incredible danger and harm, and we have to change that immediately. And so our condolences go out to her family. Can't even imagine the grief that comes with that, and we just have to resolve to do better and work harder to avoid those situations. And so, like I said, we'll be asking for investigation and keep pushing on this with your help. With that, I am really excited because Senator Jeff Brandis is joining us. He's a longtime champion in Florida. And I'm going to have Greg Newbern, our state director, introduce him. But first, I want to introduce Denise Rock, who is the executive director of our partner organization in Florida, Florida Cares. I've said this 1,000 times. I don't know a better advocate for families than Denise. She is tireless. She's creative. And she's got endless patience. And I just can't say enough about her. We are so grateful to have her as a partner. And so I'm excited that she's going to be here to help facilitate this discussion. And now I want to introduce Greg Newbern, our state director. He's forgotten more about sentencing law than most of you and I will ever know. And he's an incredible asset for us. And I know he's excited to have Senator Brandis here. So I'm going to ask him to introduce the senator for us.
Thanks, Kevin. It is an honor and privilege to introduce State Senator Jeff Brandis. Senator Brandis represents the 24th State Senate District, which includes part of Pinellas County. I'm sure we'll talk a little bit about that. Senator Brandis has served in the Florida legislature since 2010, and he served in the state Senate since 2012. And he's currently the chair of the Senate Appropriations Subcommittee on Criminal and Civil Justice. Most importantly, I think for our purposes today, Chair Brandis is a dear friend of FAM, and as Kevin indicated, just the undisputed champion of criminal justice reform in the Florida legislature. I'm sure we'll talk a little bit later about that work, but we could not be more thrilled that he's taken some time today to chat with us. So thank you so much for joining us, Chair Brandis. We're happy to have you.
Thanks so much. Great to be with you.
I'm going to just start in, and then we're going to, like I said, we'll talk for 20 minutes and then we'll take some questions. But I just want to say you probably saw, because we see you on social media, we had a series called Why I Care, where a lot of family members were sharing pictures of their loved one and talking about why they care about these issues. And I thought that's just a great way to start. I mean, why do you care? You clearly do. Why do you care so much about these issues? It's not everybody thinks that a Florida Republican state senator is going to care as much as you do. So where does that come from?
So I remember back probably 5 or 6 years ago now in my first committee assignment on criminal justice. And I'm not an attorney by trade. I had no real connection with this issue at all. And I sat on the committee, and I remember hearing a story about an inmate in South Florida who was placed in the shower. The shower was turned all the way up, and they left him there. And they came back 2 hours later, and he had passed away, despite the screams coming from the shower. And I remember looking around the committee room and having almost this feeling of panic, like I was on a plane at 30,000 feet with the engine out and nobody at the controls. And I remember we kind of moved on from that subject. And that left a very deep impression on me. And I began to look at the broader issues of criminal justice and realized that, frankly, in Florida, we had not had really a champion on criminal justice issues for almost 2 decades, and began to work to try to understand what was really going on here. We had had a number of corrections secretaries. I mean, we had been moving through the corrections secretary role almost at one a year up until our current secretary, since I had been elected in 2010. So imagine any organization that had had 8 or 9 different CEOs in the course of 10 years, and you would recognize the chaos that you would have. But then we had nobody really looking at the sentencing laws, nobody really looking at diversion opportunities, looking at what was going on in the facilities. And frankly, no legislator had really been actively visiting prison facilities at scale in really many, many years. And that's a power that legislators all have. They have the ability to go in at any time, and at least in the Florida legislature, go to any prison that they want to, show them their legislative ID, and get a tour right then. And that is day or night. And so we began to go on those tours, but then invite other legislators on those tours and show them just the living conditions, the fact that almost 80% of Florida inmates don't have air conditioning, and how decrepit the dorms had become, and the problems with inmate idleness that had lasted frankly for decades in Florida, and that there were really no opportunities for education. And so we began on this kind of mission to say, well, what would it take to really fix this? How do we talk about diversion at the front end? How do we look at sentencing reform in the middle? And then how do we look at release options on the back end? And what are we actually where are we releasing people to? I mean, people would be shocked to know that people get $50 in a bus pass when you leave Florida prison system. And so that wasn't acceptable to us. So we began kind of a multi-stage approach based on the data, based on the information and best practices from around the country, and looking at what other states were doing on some of these tough problems. We began to tackle that.
Well, I just want to say, I mean, obviously, we also had a campaign about visit a prison. We didn't need to convince you. You had been doing that, but we were grateful that you ran those tours. And I mean, what do you think, besides conditions, what do you think lawmakers can learn? I mean, our thing was like, don't legislate until you learn, right? Like, I mean, every time we lobby, we're so surprised, or family members are surprised, and they say, if these politicians, knew what these conditions were like, or knew what it was like to not be able to visit or make calls or do these things, they might change policies. And so that's, that sort of proximity is what we were going for. I mean, what do you see when you go, and what do you think your colleagues see? Are things being learned, and what can you draw from that?
Yeah, so I learned something new every time I visit a facility, and I've visited dozens of facilities throughout Florida. I haven't visited everyone, but I've visited many, and a few twice. And I've seen a variety of different situations every time I visit one. And I learned something by speaking to the corrections officers, by speaking to staff, by speaking to the educators, and by speaking to those who are incarcerated. And, we learn about, the gang population in Florida and the growing challenges of gangs and what that means, and the abuse that goes on with that. I learn about the education environment. It's not uncommon to go on to a prison facility with 1,500 different inmates and only one teacher or no teachers at that facility. And so you say, well, what are you doing all day long? There's nobody running organized activities on the yard. There's no education going on. And they say, well, we sit on our beds or we sit on the yard, and that is their, and then we have 3 meals, and that is their experience. And so while we talk a lot about incarceration in Florida for decades, it's really been about warehousing. It hasn't been about incarceration. And it's never been really about corrections. We're beginning to change that. But I think, if we talk about what kind of output do we want at the end of the day, do we want somebody who is a hard criminal, who's been influenced by gangs while they were in, and only taught that the deal with aggression by ramping up the level of aggression? Or do we want somebody who has learned the skills that you and I have about how we try to mitigate that at every opportunity, and try to move away from that, and address those issues in a very different way, in a much healthier way. And we learn what skills are people gaining while they're in the prison facilities. For example, can we just get people literate? Can we get people to read? Can we give them skills so that when they go back home, they'll be able to get a job and be able to engage in the workforce again? Because we know that's a leading indicator. The ability to hold a job and keep that is a leading indicator for decreased criminal activity in the future. But we're not doing anything while people are incarcerated with us for 5 years to get them literate or to get them educated or to get them active or to deal with some of these other issues. And so that's been the major push for us over the last few years on the prison front, is to get those functioning again.
Well, I would say, you're in good company here, and we're in violent agreement, and I'm sure all the families listening are. And I'm not going to break any news by telling you that your colleagues in Florida are not there yet. And so Florida has been lagging despite your efforts and Greg's and Denise's, to keep up in terms of criminal justice reform. And what's the disconnect? What don't they see that you see and we see?
So I always tell people it takes kind of two things to get major legislation to pass, and that really is, you need a vision and you need a champion. And so in Florida, we have not yet established the vision, right? No, and I think the Senate has begun to shape what the Senate's vision is. But I think if you ask the governor and you ask the House, there isn't this common vision between the three parties as to what ultimately we want in the correction system, what we want that overall to look like. I think if you juxtapose that with education in Florida, where Florida's really a leader, and people would say, well, no, we want school choice, we want options for parents, we want better outcomes all across the board. We're really looking for, versus the prison system where you kind of get the this emoji. I think that's the major disconnect right now, is we have to establish a common vision for what we want. And then I think we can begin to develop champions. I don't think you come in as a champion. I think you develop them over time. And that comes with, really immersing yourself and marinating in the policy of corrections and in criminal justice system overall.
Well, we're in a pandemic now where a lot of the things that should have been done are now, it almost feels too late, or that we should be doing them, in an emergency. But if we had taken proactive steps, the problem wouldn't be so great. So I know one of the things that FAM has been pushing around the country is, compassionate release or conditional medical release, geriatric parole, and also just shortening sentences. So these people who are at the end of their terms, we don't need to hold some people as long as we are through these mandatory minimums. And Florida's got some of the worst of them. Can you talk about some of your legislative efforts, things that you think might have helped address this crisis before we got to this point?
Sure. So there's a number of things we could have done and should have done. And we worked on a couple of pieces of legislation this year specifically as relates to that. One, really looking to streamline the process by which people can apply for conditional medical or elderly release. Many states have these. They're very successful across the country. We looked at the federal model for conditional medical release, which vests that power with the head of the Bureau of Prisons. We think that in Florida, we have this two-step model where you have to clear the hurdle of DOC, the Department of Corrections, and then you have to clear the hurdle of our FCOR group, which is the group that really looks at and is the final approval, if you will, of conditional medical release. So let's streamline that process. Ultimately, we believe that the Department of Corrections has accountability for those people anyways, and is responsible for those individuals anyways. And so let's give that power to the Department of Corrections and streamline that entire process inside the Department of Corrections, because they know these individuals. They know they're elderly individuals who've been there with them for 20 years and are unlikely to commit new crimes because they've just aged out. There isn't a lot of 70 and 80-year-old bank robbers anymore.
Right.
So what can we do on that front? And then on the conditional medical side, same thing. I mean, I can tell you a story of a person I visited at Lake Facility, and the warden pulled me aside and said, this gentleman has stage 4 cancer. He's a veteran. He's got a family to go back to. Can we get him conditional medical release? And so I began to advocate, got it through the Department of Corrections, got it over to FCOR, and then it didn't pass on a vote of 2-1. They voted against letting him have conditional medical release. And when I followed back up 2 weeks later and I said, he's gotten worse, what can we do? Can we reevaluate this? By the time that I'd followed up, he had already passed away. And so it made me believe that there's a better way. And so we looked at the Federal Bureau of Prisons, the process they follow. And while it's imperfect, it is much better than the state's current system. and something that I think we should have used and evaluate and put in through legislation. But again, we couldn't get a common vision for what even conditional medical and elderly release should look like. And so that's an area that we're going to come back and address, try to have an agreement on a common vision, because I think we've got to get, what I consider the low hanging fruit. Elderly release, conditional medical should be the low hanging fruit of the criminal justice system, and definitely prison policy that you should get right. Florida has thousands and thousands of elderly inmates that are unlikely to commit new crimes. And if they have a family to go back to, and if we can find them a safe place to live out the rest of their days, we can put them on electronic monitoring. We can send our community corrections to help monitor those individuals. We can do other things, but they are, we are dedicating an oversized amount of resources in the prison system to a small population of elderly individuals who are unlikely to commit new crimes, when we could be spending those resources where they would be better utilized. And that's something I'm going to continue to advocate for the rest of my term in the legislature.
Well, I just want to follow up on that, because that didn't get done. And so now here we are.
Right.
And it just so happened that, the people that we thought didn't need to be in prison anyway, 6 months ago, because they're the least likely to reoffend, the costliest to maintain, all the reasons why you said that. Now, these are the people who are most vulnerable to COVID.
Right. Every death we've had in Florida's prisons, all of them have been over the age of 60.
Yeah. Well, so here we are though now, and the legislature's out, and sort of our mantra has been keep them safe or send them home. I think not everyone thinks that their loved one's going to come home. This is not going to be a prison break. They realize that, but there are people who are vulnerable, and now, so there's some mix though of smart decarceration, safe releases. We see sheriffs having to do this on the front line, but the governor has said no releases. I'm not considering releases. I mean, I don't want to put you on the spot, but I mean, how do we square that?
No, I think it's frustrating, because there are simple things we could do. For example, let's look at people just that are 30 days out. Let's look at people that are 60 days out. Let's transition them to home confinement if they have a safe place to go. I think these are people who are going to get out anyways. And if we haven't corrected their behavior, then we have real problems, because we've had them for 3 to 5 years in many cases, so or decades in some. So I think it's an opportunity for us to advocate, but I think this has galvanized the community of people who have loved ones that are incarcerated to reach out to their legislators, to reach out to the governor, and prayerfully ask for them to reconsider their position. And
right.
I think that's our best place to be. Is we have to act within our within our public roles, but I have to act within my faith. My faith tells me that I should treat myself like I'm in there as well. And so if I'm acting on my faith, I truly believe that given this crisis and everything I've seen and the amount of problems we have in the Department of Corrections, this is not a department that can really support 100,000 people incarcerated. And so to the extent that we can get that population down to the people who truly need to be incarcerated and truly are continuing to deserve of being incarcerated, and provide them with programs and services and things that those that are going to get out, and frankly, even your lifers, giving them a purpose, because it's important that they have a purpose in life.
Yeah. But I mean, for the families who are dying, to advocate and take action, I mean, is there any target left of this advocacy except the governor? I mean, who else has authority at this point?
Not right now. Not right now. I mean, I think you've got to advocate to the governor, and you've got to, one, everybody should meeting with their local legislators and telling their story. Two, they need to be informing their local legislators what's really going on inside the department. Tell them, I get regularly, different venues, people contact me, whether it's letters or whether it's Facebook posts about what's going on inside of facilities, and I'm able to help where I can to try to mitigate that. But I think right now, during this specific crisis, the only person that really has the authority, even beyond the head of the Department of Corrections, is the governor.
Well, let's bring in the families, and I'm going to go to their questions soon, but I want to ask Denise, because you really are on the front lines. What are people saying? What are you hearing? I know what we're hearing, but like, what is the frustration, or what's the greatest need, do you think?
Right now, I think the thing that people are most concerned with families are, if the governor is going to is visitation going to be resumed as normal? Families are anxious to get back to their normal lives. What will the new normal be like? Will they be able to wear their masks into visitation? Will they be able to bring a small bottle of hand sanitizer? At probably 80% of the institutions, the bathrooms are locked and there's no soap in them ordinarily. And so, and there's no paper towels in them ordinarily. And so what will that look for them, as they return to the prisons to visit their loved ones? So that's a concern for them currently. A lot of people are talking about they've received the face masks and they're in all the prisons, but I hear constantly, officers aren't wearing them. It's an election, to wear them. I know it's hot and uncomfortable in them, and that's something we just don't know how to combat, Uh-oh.
Oh, there you go. It's interesting. I've been saying that like the officers and the people incarcerated are kind of on the same side. They all want health right now. And so, I mean, you have that natural tension and the rest, but, this is an issue about officer safety as well, isn't it, Senator? Oh, you're on mute.
All right. No, absolutely. Listen, it's everybody in that facility. That facility is, and what we've seen at both, Sumter and at Tomoka is it's not just those that are incarcerated that get this. It spreads through the facility very, very quickly, and guards are affected, corrections officers are affected, and other individuals are affected throughout the facility. And if it gets into food service, it's, can go facility wide very, very quickly.
Yeah.
So I think it's, it's critically important that we address everybody who comes in, and they're doing that with temperature checks. And then now we're beginning to talk about randomized testing. They're going to start they're going to start a much broader testing regime, knowing the corrections secretary as I do, and him being a former 2-star general in the military. I'm sure there'll be some risk assessment based on where they test, based on risk, as ultimately how they play that out. But I think you are going to see increased testing. I think you are going to see us really trying to ramp this up to get a better handle on, our hotspots, but then more broadly into other facilities as well, based on risk.
Greg, I'm gonna start taking some of these questions, but he mentioned testing. So can you talk about the letter you sent to Secretary Inch today on the issue of testing?
Sure. Very early on in this crisis, it became clear that families wanted more information. So one of the first things we asked of the department was for greater transparency. I know Chair Brandis had made the same request, and the department was very good about increasing, I think, fairly quickly the amount of information that was available publicly. And now on the FTC website, you have total tests of prisoners. You have staff positive infection rates. You have a bunch of information that wasn't available immediately. But part of that information, like having access to that information, now we can make some inferences based on it. And one thing you see from the publicly available information is that the testing rate is just too low, right? And as the chairman mentioned, I think we're going to start seeing greater testing, and that's great news. Until now, the positive rate, which we define as the number of positive tests per test given, was something like 47%, right? And that indicates a significant number of people who have the virus but have not been tested for it. Because as we point out in the letter, the World Health Organization recommends a 10% maximum positive rate. So again, I mean, and not everybody can get tested on the outside. We have inherent testing limitations. It's difficult to do this. So in our letter, we say it's despite the best efforts of the department, the data indicate that it's just too low to actually reflect the extent of the testing. So we asked the secretary to expand testing. It seems like the secretary has already been moving in that direction, which is fantastic news, and families will be happy to hear that. And we also asked for some more transparency. We're happy that the staff infection levels are available publicly, but without knowing how many of the staff have been tested, you can't calculate that positive rate either. And it really is the positive rate that tells you whether the testing is sufficient. One of the things on the Department of Health website for Florida generally, right, you can see how many tests are given. And here in Florida, we've done a fantastic job of reducing our positive rate below 10%. It's now below 9%. And so that implies that there's fairly adequate testing. Obviously, you want even better, but here in Florida, relative to other states, we have that positive rate that's lower. But when you compare FDC's positive rate to the state rate, generally, you see that it's just simply insufficient despite best efforts. So we wanted the expanded testing of incarcerated people. We want better transparency of the staff testing. And then we also, based on the experience of some of the other states, we're concerned about staffing levels, right? This has been a problem in Florida generally, pre-pandemic. Staffing levels have been an issue. And so in other states, we've seen corrections officers and other staff stay home, either because they're sick or they're symptomatic, or because they don't want to go into work because of some fear of contracting the virus. So we asked, with the understanding that staffing levels can be an issue running a facility, we asked to make sure that FTC keeps the families apprised of any staff shortages, as well as steps taken to mitigate any of the staff shortages. And then finally, we had a request, and I don't know if a document like this exists in Florida, but I know in several states, the departments of corrections estimated the impact of the virus on the prison system and made recommendations about releases or how to combat the threat. And so, because we don't know whether that document exists here, we requested that if any state agency prepared a document that estimated the impact of the coronavirus in state prison, in our state prison system, we'd like to see that document so we can know, what did we think was coming, and then how has what actually has come is that close to what we expected, and then what was our recommended response, and how has our response been relative to those recommendations. So in a nutshell, it's just greater testing and more transparency, which is exactly what the families have been asking us for.
I really have to go to the family questions now because we're halfway through. A lot of them, there's specific bill numbers like 564, HB 189, bills that are, I think what they're wondering is, are those dead now? I mean, do we have to start all over again?
We do. Unfortunately, we're going to have to wait till the next legislative session, which will start up back in March of next year. But in the interim, we're working with the department, we're working with the House. Again, we need to establish a common vision. And so once I think we can agree on what the common vision is, we can begin to design specific legislation that matches that vision. And so if you say, look, we want to focus, we've had incredible success in our juvenile system with diversion. Because juveniles, many times adults too, don't get better when they're placed in juvenile facilities. And so where we've had a lot of success is in diversion, and then follow up in the community and making sure those juveniles are supported. If I could just take that and adopt it in the adult system, we would have an incredible amount of success. And we've seen some of this with civil citations and adult civil citations of diversion when possible. And when appropriate. I think that's something we're looking to do. Part of the budget this year, and we hope that it makes it through the budget process of the governor and the veto pen, is including risk assessment tools, because we've seen that be very, very valuable in dealing with juveniles as well. Is every juvenile gets a full risk assessment done. We think that will assist. We have a criminal punishment task force going on that we started last year. They're actually holding a meeting today, right now. And so we think that task force will come forward, hopefully with some strong recommendations to review the criminal punishment code, because this hasn't been reviewed in 2 decades, other than, the legislature meets every year, but it's not like we've done an in-depth deep dive into the criminal punishment code. And so I think you're going to see some of that. I think you're going to continue to see us press on the 85 to 65 or some other number other than the 85% to work towards incentive models. because we know that the number one incentive you can provide for somebody to engage and to behave while they're incarcerated is to reduce their sentence time. And so we're working on that provision. You'll see us bring back the conditional medical elder release, and then you'll see us continue to talk about an incentive-based model even while we're in the prison system, so that we have some facilities for those that truly want to change their lives, and for those who continue to engage in criminal activities even while they're incarcerated. You're going to see us try to differentiate by facilities our prison housing, so that we can try to incentivize better behavior given the current construct, even without legislative changes.
Well, I was going to say, and one of the questions I'm going to ask, I can relate to, because there's a frustration. There's a little bit of, it's like Charlie Brown and Lucy every year, where the Senate does a lot of good work and everybody gets their hopes up and they see a lot of good bills. And then they think maybe this is going to be the year, and then it dies. And, you know, just as there are leaders, there are, how shall we say, non-leaders. And there was a lot of frustration at the end of this last session, and the questions that are coming in about whether we can pass something if Jamie Grant is chair of the Criminal Justice Committee on the House side, and whether, you know, if somebody's just not willing to move something, or not even not willing to have hearings, what are the options? Like, what do families do to get around that? I mean, where does the advocacy go? And
so look, I always tell people the House is like a military organization. It's got its generals, its colonels, its captains, and its soldiers, and the Senate is like 40 Somalian warlords. You know, we're often not sure who's in charge in the Senate, and you know, our territories grow and shrink any given time. But you know, clearly, you know, they are taking directions from the senior leadership of the chamber, and so until we can get the senior leadership to agree on a common vision, it seems difficult that the House will move major policy. If we can get agreement on a common vision, and I think there's some things that we can work with them on, and then oftentimes in the legislative process, you have a rare window of opportunity to pass certain legislation, but you need to be prepared to pass it every year. Mm-hmm. But then, you know, the stars align, and I hate to say that we have to wait for the stars to align, but frankly, having been in this process now for a decade, I can tell you that some 2-year periods, certain bills are just not going to pass. But then other 2-year periods, that bill has a very good chance of making it through, or absolutely will pass that year, because the leadership has a different perspective. I think we're going into a next 2 years where we have some challenges on a common vision, but that doesn't mean it's impossible. It just means for legislators like myself, we have to passionately advocate, and we have to build coalitions, and we have a little bit more of swimming upstream to do, but it can happen.
Yeah, I mean, Denise, you hear this frustration maybe as much as anybody. And how do you keep people motivated? And what do you tell families who say, these guys are never going to do anything?
Well, it is very difficult. And I do have to say that families have gotten more involved in the political process, which I think is a good thing. They're more aware of who their legislator is, what a House representative is, what a senator is, who they should vote for, what their issues, what issues are important to them. So I think that's awesome. They know what a delegation meeting is now, and they've become involved in the process. And I think that is awesome, and they will continue to grow in that. And they've also become just more involved in general on knowing how a bill becomes a law, getting to Tallahassee, understand the process. And I think that's very important for them in general, understanding sentence structure, what felonies are, what a first-degree felony is. I mean, they've just become so knowledgeable. It's awesome. And I think that the more that they do, the more that they're able to educate the legislators in general, because they're also not, you know, some are firefighters and stuff, you know. So I think that it is a good thing for them, and they will eventually be able to sway legislators and convince them themselves of the wrongness of some of these sentences.
Good.
Mr. Brandis, that you mentioned that I just wanted to talk to you about for a second, if I could, is you mentioned about having incentivized prisons and then other prisons that were for non-incentivized places. And I think maybe you were referring to what was recently a rule change that DOC tried to implement or is trying to implement, as you said, non-legislatively. And they recently were trying to put in what they called, I think, administrative management units. I forget the name, administrative units. And it just rather seemed a little bit like it was going to become a place for just where you would throw the bad people in kind of like gang or drug camps. And I just wanted you to know that families are very concerned about that and would prefer to see a place where if people were struggling with drugs or gang involvement, that those were people that were getting extra attention, not less attention.
Right.
Those people were having, that those visits were not limited, and that they were having extra programs, not less.
No, I think you've got to make your investment in I'm somebody who believes that incentives matter, and you've got to incentivize people along the way to change behavior. And so to the extent that we have people who want to do the right thing, who want to follow the rules, who are doing their time and then trying to transition out and not involve themselves in criminal activity while they're incarcerated, and that is an opportunity to incentivize those individuals. I think for the other individuals, you're correct. We need to provide them services as well, and sometimes heightened services, because one, it takes more to supervise, but two, we know that inmate idleness has been a problem in the facilities for decades. And so what can we do to engage them so that they have other options versus figuring out how to engage in other activities? Because the saying that the idle hands of the devil's playground absolutely plays out in the correction system as well. And so what else can we do? And I think it's really looking at how do we modify incentives outside the legislature if possible, because that tends to be a tough way to get through. But then how do we look at programming? And to the extent that we have a population that we know we can just monitor versus the population that we know we're going to have specific interventions. And I don't think we're saying less programming for those. I actually think you have to invest more in those, because those are the ones, I know this amongst my family and my kids. There are times when I have to invest a lot more time with those that are struggling than the ones that are doing just great and are and just need to kind of be monitored and shepherded in a different way.
I just want to, I don't have a question on this. I'm just going to flag and acknowledge that a lot of the comments coming in, people feel very strongly that Governor DeSantis and Jamie Grant are the roadblocks. Like I said, there's really nothing to ask about that, but that's just like a palpable feeling that people have. And one specific question though, Greg, that I know is near and dear to your heart, and Denise fielded a lot of questions on this when it first happened, was Amendment 11. This idea, we made a push that Florida, we need retroactive relief. Everyone thought they were voting for that with Amendment 11, and then sort of realized that, in a frustrating way, that just gave the legislature the authority to make laws retroactive. Can you talk about that, and what do you see as the lay of the land for retroactivity in Amendment 11?
Yeah, it was 1885. The legislature was powerless to make sentences retroactive from 1885 until 2019, and now they do have the power to make sentencing reforms retroactive. But just like anything else, that's a case that has to be made. And even with a newfound power, it's hard to rush right into it and say, okay, now we're gonna do it. It's a case that has to be made. And I think it's a case that is being made, right? When you have the Tampa Bay Times with a big story on hundreds of people who are still incarcerated, focusing on the Jamar DeLeon case, showing how a person who has 15 years would now get out in 3, and telling that story and realizing that there are hundreds of others, and FAM has profiled them. Cynthia Powell, who's in for 25 years and would now serve, I think, 3 or no more than 7 for the same offense. You tell those stories and eventually it starts to catch on. Eric Wyant, who's done more than 10 years on a charge, aggravated assault, that now would carry no more than 5. Right. And you tell these stories in the same way that you told the stories to get the law changed in the first place. And eventually it will catch on. And, look, there are bad ways to do retroactivity, but the fact that there are bad ways to do something does not mean that there are no good ways to do it. And we are constantly exploring the best possible options to work on retroactivity. And just like the chairman said, you have to have a vision generally. You also have to have a vision where retroactivity fits. And that takes time to develop. It takes time to create the narrative and tell the stories and explain how it works. A power that hasn't been available in more than a century, you have to figure out how it's going to work. And I think that's what we're doing right now. And I absolutely have faith that the legislature will get to retroactivity, because it's just so obviously the right thing to do. And I don't think you can keep a good idea down forever. So I think we'll get there. It's just a matter of getting it right.
Well, I was going to say, Senator Brandis, you may be able to give us some insight to this. This always seems to me to be just about fear, about not wanting to vote to let somebody out who may reoffend. And maybe I'm wrong about that. But I mean, as a moral issue, it's so obvious that somebody's punishment shouldn't depend just on when they committed their crime. I mean, if the legislature acknowledges we overpunish this class of people, and you told stories that convinced us of that, and then you don't address it for the people whose stories you told, that just feels completely wrong. But there is something that stops. It's not just in Florida, it's other places. I mean, people ask us all the time. I mean, they say, why isn't Florida making retroactive, or why doesn't Congress do it? They never do it. The default is not to make these laws retroactive. But what do you think drives that? I mean, is it a sense of, well, certainty in punishment, you got that punishment, or do you think it is a fear that I'm going to let somebody out who's going to reoffend?
I'm sure it's a combination of things, right? I'm sure it's, and people will throw up smoke screens for what it could be, and there's always the one case, right? And that, I think that's what we kind of come back to, is I've always heard, oh, well, this person in this state did the following thing, and he was 72 years old, and therefore we can't streamline the process. And you go, guys, but that doesn't work at scale. And so how do we? What is, again? I hate to come back to this, but once we establish a common vision and say, all right, here's the people that we really need to focus our resources on, and here's how we're going to manage the limited amount of resources that we have, and here's the people that are unlikely to commit new crimes, and here's the people that we should focus on diversion for, because they're not going to do better inside the system. And if we ultimately want them to engage in civilian life and be productive, maybe placing them in prison for a long period of time is not the best thing for them or for the state. But I think that portion of the conversation has to come back to, all right, establish common vision, and then we can build to that vision. But until we establish this common vision between the governor, the Senate, and the House, we kind of all have to play on these one-offs. And in the way the Florida legislature operates, which we're only in for 2 months out of the year in session, oftentimes these decisions, they say, well, we're not going to make that decision until the very end of legislative session, and it's going to be held hostage for your vote on 3 or 4 other things. And then by that time, it falls off the table. In the meantime, we recognize there's 100,000 people's lives who depend on that decision, and potentially thousands more every year as we're making these decisions that affect into the future. And so, to me, we have got to begin to coalesce around this. I'm just trying to look, let's have a clemency hearing where we actually grant clemency to somebody. We have 100,000 people incarcerated. Don't tell me that over the course of a year, no one in the state of Florida is deserving of a look for clemency. I mean, that to me is kind of violates my soul there. That there is, clemency is an act of grace. We can't find one person to grant grace to. So to me, let's start basic with the powers that we already have.
Yeah.
Let's look at streamlining the process for elderly, for conditional medical. Then let's look at diversion. Then let's look at our prison system itself and what we can solve. These are all, we have best practice models from around the country. We know what works because we know the evidence of what's going on around the world.
I'm the non-Floridian, so this could be ignorant question, or you guys are gonna know exactly what I'm talking about. They want you to discuss 1308 specifically.
So Greg, I'll let you start.
Yeah, one thing that if you're not involved in the process day to day, you may not know. As soon as the handkerchief drops, bill numbers escape brains. Like
Okay.
And I know we didn't do the handkerchief this year, but 1308, if I recall, that was sort of the big train at the end of session where we had a lot of different sentencing reforms that were moving. It didn't ultimately move, but it was another. And as the chairman said, sort of at the end of session, when everyone's kind of jockeying to try to figure out, are there vehicles that can be used to move good policy? It happens every year. 1308, I think, was one of those that that Chair Brandis came up with that included any number of things. But I think maybe the most important one was the second look provision that Chair Brandis came up with, which and I can let the chairman talk about it, but in the end, it's something that FAM has advocated for a while, which is if you have a really long sentence, let's take another look and see. So maybe the chairman would like to chat about why he thought that was important.
Yeah, that's a good idea.
So I think, we've seen this in other states. I truly believe it's a best practice. I think we have no farther to look than our friend Sean Hopwood to see that people change while they're incarcerated. And so kind of based on his story and the stories I've heard from countless others, we recognize that people are not the same 10, 15 years into the sentence that they were when they first committed their crimes in their early 20s. And so let's have an opportunity to look at those individuals, provide an incentive for them to get an education, get job skills and training, and then let's look at them in a fresh way a decade later or years later, and reevaluate whether they're still, that the punishment still deserves that they stay incarcerated, or whether we can step that down in a responsible way with supervision to back to their communities and let them re-engage there, because they're much less likely to commit crimes based on the 10 years of evidence that we have watching this person on a daily basis while they were incarcerated.
Yeah, no, and it's a big priority for us, as Greg said. I mean, our view is as many system actors as possible have got to get the authority to review sentences. I mean, you've mentioned there's clemency authority, but if they don't use it, but we need to get judges, prosecutors, the executive branch, everybody needs to have a chance to take a look at these sentences. Denise, you may hear this a lot, and also I'll start with you, and it goes into second look. Why are they using past criminal history from childhood to validate? I mean, it says to validate points as a requirement. I'm not exactly sure if that reads right, but the point being, some people, because of the mistakes they made when they're younger, never get out of the penalty box. And so do you hear that a lot? And these people are not available, no relief is available for them at that point.
Right. So a lot of people think that, what crimes that happen when you were a juvenile, you hear that they don't go on your adult record, but on your score sheet, they're absolutely counted in Florida as part of your points. So people are shocked to learn that when they're added up here. Yeah,
and I think people think about second chance and they think of, I always talk about Matthew Charles. You bring up our board member, Sean Hopwood, and he's a friend and he's an incredible success story. But Matthew Charles, who people know was the President Trump's guest at the State of the Union a couple of years ago and first beneficiary of the First Step Act. I mean, the crimes he committed in his youth were serious. It wasn't just, that he was, some small, low-level drug offender who did something and, we can forgive that. It was serious, but he had a genuine change in his life. And Sean talks about just growing up and the idea that, we don't let people change. We don't adapt for that. And so we want to put them in a box of violent or nonviolent or all these things that keep them from ever getting that second chance. So, well, I guess I should just say, I mean, we're grateful for that bill. I mean, we'll do everything we can. I think among families, that is, if not the highest priority, it's up there because, you know, these folks, some of these offenses are more serious, but they've aged out of crime, as you said, and they just want a second chance. And having that light at the end of the tunnel, knowing that you're going to get a second look, could really incentivize people to change and grow. So,
Yeah.
I mean, thank you for that.
No, Sean has said, character is not static.
Yeah.
And I believe that. I am not the same person in my 40s that I was when I was a soldier in my 20s. And I've learned and I've grown. And I think people who are incarcerated have learned and grown. And so when, especially in Florida, where we have these extremely long sentences, it gives us a unique opportunity to take this second look, to take a step back and evaluate this person with fresh eyes. And I think that is an act of grace that my faith calls on me to look at. And it's something that I think the legislature could fully embrace, is this idea that, look, these people are going back before a judge. It's going to be a trial court judge. It's going to be somebody who is, if it was the same sentencing judge, if they're still there, but they're going to get a second look based on the evidence of their term of incarceration, and based on the evidence of the victim statements, based on the offense that they committed. And we're going to be able to evaluate this with fresh eyes, because as the legislature gets different perspectives, judges have different perspectives, and we can really truly look at the evidence again. And I think that's important.
Somebody say something? Okay. We talked about champions and non-champions, and sometimes this is just a matter of people, individuals who take on leadership roles and are able to move things. And so here's a question you may or may not appreciate: is Senator Brandis running for re-election? If not, my concern is that we won't have a Republican champion in Florida, and they realize how important that bipartisanship is.
So I think I'm termed out in 22. So I've got 2 more years of pushing and advocating and researching and putting my best ideas forward, as I try to do every single year. Mm-hmm. I'm somebody who believes there's a few big ideas in every area of public policy, and my job is to bring those forward and highlight those every year. And so that's the type of legislation I work on. But then I think I have the responsibility to develop champions. And I think what you're seeing us work with our partners in the House to identify individuals like Byron Donalds, someone who's running for Congress down in South Florida now, but was in the Florida House. But I think we're developing champions every year. And I think, and amongst my Democratic colleagues, my colleague Senator Pizzo comes with, former prosecutor, but comes at this in a very different way, and is truly a champion amongst both parties, because generally he's got the most experience in the room on this issue, almost no matter who you talk to. But I think our responsibility now towards the end of our term is to find champions, which is why as soon as the prisons are back open from COVID and legislators can safely go visit again, we're going to be out visiting. We're going to be encouraging members to come visit. And it's not just senators. I bring everybody in the region I try to reach out to every time I go to a facility and bring them in and just get them educated. Oftentimes, it's the first time they've ever walked through a facility. But when you walk through as many facilities as I have, you learn the questions to ask, you learn the things to look for, and the things and part of that now, that responsibility for me is to teach and to grow champions.
Well, and I think one thing that Denise, I've always appreciated is the prison talk she does outside the facilities after visiting, and when lawmakers get a chance not just to see a facility, but then to meet the family members, because I think that's a cost that goes, undercounted in the balance sheet of when we do cost benefit on public safety, which is, crime hurts and victims, that all needs to be taken account of. Sure. But there's innocent family members, there's kids who grow up without parents, and there has to be a way to make sure that that's part of the calculus. I want to say, because we're gonna finish up, but first I want to ask everybody to just give some last remarks, and I want to start with you, Senator Brandis. Oh, wait a minute, can you run for governor? You don't have to answer that.
No, my wife would probably have a very different perspective after serving for 12 years in the Florida legislature, and her taking care of 4 kids while I'm gone up in Tallahassee for 100 days out of every year. But look, I don't know what my political future holds or if I'm going to be involved in politics in a few years, but I do know that I'll be involved for criminal justice reform the rest of my life. This is something deeply personal to me now. I truly enjoy the conversations, but I truly enjoy the policy aspect of it. And it gives me a place to practice my faith in a different way. And I am encouraged daily by the families that I meet, by the people that I speak to, and by the hope that hopefully I can provide to those. But this is something that's not going to go away, whether I'm serving in the legislature or whether I'm going to be working with FAM or other organizations in the future to passionately advocate, because this is a lifelong passion now.
Well, we're grateful that it is, and we're grateful for what you've done. I want to ask you what, for the families who, they do lose hope at times. And I mean, what I always say to them is, we may fight and lose, but the only way to make sure we lose is if we don't fight. I mean, so you just have to, you almost have no choice but to keep going. What's your advice to the families, and how should they get involved, and what can they do to make a difference?
So the number one thing that you can do is to meet with your legislators. For most legislators, they don't have a lot of history with individuals who have similar those stories, and so they need to hear your story. I have a mom who visits me every year, and she has traveled she's moved 7 times, because as her son, who is currently serving life in prison in Florida, as he moves to different facilities, she picks up and moves so she can be with him. And I've told people I will never bet against a mom in a story. And so what can we do to tell our stories to legislators? How do we continue to educate them? We, in the Florida House, they're changing out, very often. And so new crops come in. In the Senate, we serve either 8 or 10 years, and we're moving on. Florida has term limits. We need to be constantly educating, telling our stories to our legislators, and building a coalition of individuals. What I can tell you is, since my time in the last 10 years, we have had more voices in the correction space today than I have ever seen in the process. And that is because of hard work of FAM, groups like Florida Cares, other passionate organizations who are beginning this groundswell of support, this grassroots support, and telling their stories to legislators, coming up and visiting Tallahassee while we're here, and then encouraging us to visit facilities, but then telling us the stories of their incarcerated loved ones while they're in the facilities, and understanding what's going on. It's also encouraging our Department of Corrections, right? They have an incredible role to play in all of our lives. And so when we have somebody who comes in like Secretary Inge, how do we encourage him and support him as he is working to proactively make these positive changes in a system that he inherited that was frankly terrible, and frankly had multiple leadership changes and a ton of problems throughout the system, to the point where he said it was a plane on a downward spiral. And so how do we continue to support legislators like him? And then how do we work with governors who may not share our vision and have their own perspective? How do we work with them to gain a better perspective and to educate them as well? We are all imperfect. We're always learning, but how do we get them to take even a portion of our vision, even if it's on elderly release, or conditional medical, or diversion? How do we get them to understand our vision in a different way, and support them to move their thought process forward?
I appreciate that. And thanks again for being here. I want to give Greg and Denise a chance to give some final remarks, and also share contact information for all of our guests. But Denise, do you want to share anything before we sign off?
Sure. To the families of the loved ones, I would say don't be discouraged, don't quit. Do something every day toward learning, toward looking at your loved one's case, toward reading, whether that is looking up the statute, looking up the penalty, reading about something in Chapter 33 that affects your loved one. There is just a plethora of things to do, and always to be able to be learning. And just do not give up on whatever your issue is. There is always something to be figured out, and we can always advocate together. the more we stick together, the stronger we become, and the better we are to be able to move this mountain. Thank you.
Yeah, well said, Greg.
Yeah, I think I would echo that. You never know what the spark is going to be that leads to the fire, right? I remember walking around the Capitol back in 2013 or 2012 with Marissa Alexander's story and with Ronald Thompson's story, looking for someone to sponsor a bill that would create a safety valve or get rid of the ag assault mandatory minimum. And I walked into then Representative Neil Cumby's office, and I didn't know him at the time, and I shared our information, and he was so appalled he had no idea that we've sent people to prison for 20 years. The stories affected him in a visceral, intuitive way, and he, being Neil Cumby, said, we're going to do something about this. And it's a meeting, like, if I hadn't had that meeting, if we hadn't told that story, then he wouldn't have made that issue his own, adopted it, and committed completely to changing it. And then a few years later, we were able to repeal that aggravated assault mandatory minimum. We no longer send people to prison for 20 years for aggravated assault. Now, we still have work to do on the retroactivity portion, of course, but the point is, you never know, right? And you never know what story is going to hit the right person at the right time that's going to lead them to make this their issue until it gets fixed. And so, as the chairman said, we've got to just keep telling those stories. I'm 100% confident that if we keep doing that, we're going to get to where we want to be. So, and just by the way, just like last time, the Senate, we've been here now for more than an hour. The senator is exceedingly busy with constituent services at this time, with unemployment and everything else out there. So, as I said at the beginning, the undisputed champion, I think that's become clear. But thank you so much, Chairman, for taking the time. We really appreciate it.
Yeah. And then I'm just going to say, I want to piggyback. Oh, here's the social media handles for everybody. I just want to say this. What Denise said is right. Don't stop learning, and you can become an advocate. And Greg talked about, sharing your story. And so the senator about sharing your stories and how that can have an impact. And I guess all I want to impress on people is, fight smart. You can fight hard. This is a period where this disease has us all with this incredible anxiety and a lot of stress, and a lot of people are home because they can't be at work. And so they're doing this 24/7. And we feel that anxiety every day. We're taking that. We know how urgent this matter is. It is a day by day thing for a lot of you. You see the test results come back. You worry that's going to be your loved one. And so use that passion, become informed. We will help you find outlets. People say, can FAM do this? Can Florida Cares do that? No, you can. We want to facilitate that. But you can tell your story, and you can call your representative, and you could go meet with them and write them. So we want to be able to facilitate that, but we need you. We're not an army. We're just generals with no army unless you guys do this work. But I just want to say, and I keep pushing this every time we talk, please take care of yourselves during this time, because this is an incredibly stressful time. And I know everyone's worried about their loved ones, but I always say, as somebody who was in prison, the thing that worried me the most is that my family was worried about me. I was okay worrying about them, but I needed them to live life and be happy and be present for one another and not worry about me, because I was going to take care of myself, and there was nothing you could do for me anyway. And so while it's great to be a passionate advocate for your loved one, and you have to do it, please cut yourself some slack. Make calls every day, write your letters, but at some point, give yourself a break and know that you are fighting as hard as you can, because you do need to be present for those who are in your life. You need to be, being happy and smart and strong is important, not just, a blizzard of activity. So it's really important that you take self-care to heart. It's a challenge that we all have as advocates right now, because this is a stressful time. But I just want to encourage you to do that. Stay active with our groups. We'll try to give you, direction, but please take care of yourselves. And thank you, as always, for joining us and doing what you do. I now want to just highlight that tomorrow we'll be back with another edition. of the Heart to Heart series, and we'll be talking about Arizona. We're really grateful that we're going to have a bipartisan crew, just like we did in Florida last week, 2 weeks ago. And now with Senator Brandis, we hit both sides of the aisle. It's really important. And in Arizona, we're going to have the same thing tomorrow with Representative Walt Blackman and Representative Kirsten Engel, two champions of criminal justice reform in that state, another state that really needs help and needs your passionate involvement. So with that, we're going to sign off. And again, as Greg said, thank you so much to Senator Brandis for giving us so much of your time. Thanks to everybody who watched and gave us questions. And we'll talk to you again tomorrow.